Thank you very much, Madam President and Senators. We spent, I think, the last several hours talking about sort of economic theory. Is prosperity going to somehow trickle down? Whether or not supply side is the way to go? There are all kinds of discussions and hypothesizing about exactly, what we are going to do and how that's going to benefit the people of California. I don't know if any of us know exactly how it is all going to work out. I think one of the things that is very, very important for all of us to remember is that human beings are dynamic. Things that involve human beings are also dynamic, and therefore changing one thing, fixing one other thing without taking into consideration all the different variables that may go into a particular solution. If we don't do that, we are, in fact, going to fail. But one thing that I do know, and one thing that I do clearly understand, is that within the budget that is being proposed, there is a cut. There is a cut to mental health to the tune of $600 million. And as someone who is well-versed and has worked in that particular field, I know that that particular cut is going to clearly impact local government. It is going to impact our cities and our counties, our mental health system, and those individuals who are receiving those services and the families and the friends and relatives related to the particular consumer of mental health care. We don't have a pretty substantial mental health system anymore in the state of California. We are lucky if we can see a patient, see a client, give them a pill, and hope that they somehow will have their stuff together enough for the next time, and who knows when that next appointment is going to be. For us to somehow cut further our mental health system, literally what we are saying to those individuals is that, guess what? You're out on your own, and you better somehow figure out a way to keep yourself together because we can't help you. And I don't think as a society that we now lack that humanity, that we are not going to say to those individuals who are in need that don't worry about it. I know you are having some difficult time, and we will find a way to help you along with the eventuality of then keeping you together enough so that you can, in fact, be full functioning and a contributing member to our society. With this particular cut, what we are going to do is to say to those individuals, well, I'm sorry, we're going to put you out. And guess what's going to happen when we just simply put these individuals out? They're going to struggle. They're going to struggle mightily, but they're going to falter along the way. Maybe become homeless, maybe get into our emergency hospitals, maybe getting into our criminal justice system, but all of that is going to be an additional cost to our communities, to our society, to our family, and those are not things that we want to happen in the state of California. Those are not the kinds of things that we want to say that as human beings that we're not going to provide some assistance to those individuals. And mind you, this is not just about adults. These are about kids. And I will tell you, with kids, they're even lower in the ladder of services for all of our vulnerable individuals. Kids don't act out. They don't run around half naked. They don't maybe carry a gun or a knife and walk into a department store and threaten individuals. They're going to be a little bit more confined. They're going to be a little bit more quiet, maybe a little bit more depressed, so that they are seething with a lot of anger. They're seething with a lot of pain, and they don't act out. But when they do act out, that's when they go somewhere and they quietly take their own lives. And that is what we are saying to all those individuals in our community, that guess what? You're out on your own. And so with this particular cut to the mental health program, we are only shifting our responsibility to our local government. We are shifting our responsibility of caring for those individuals who are in need of help to themselves and to their families. And oftentimes, there is not a support system to help those individuals. So I am not going to be supportive because I just can't, out of my sense of responsibility to my fellow person, that I just can't say to them that you're out on your own. That I have to say that no, we've got to somehow find another way, rather than these cuts, find another way to help those individuals, because guess what? Maybe one day, we, our family, our friends, any one of us could be that particular individual in need of that mental health. Thank you.